Working.
So while we're waiting, let's all stretch a little bit. Paul, you can better.
Yeah.
Sitting for a while. It is my pleasure to be with you today. I'm LaShawn Hoffman, and I get to be here with my partner in good, Dr. Tabia Henry Akintobe, who you heard from the keynote today. And we're going to share a little bit about how we've been able to move our process oh no, if you'd go back, thank you. Yeah, of thinking about community engaged research to equitable peer review publications. And so with that, earlier, the next slide, or should I use this? Or, and what do I do? So you heard earlier today, Tabia shared a little bit about her why. And I'm going to share just really briefly about my why and what brought me to this work. Isn't this a beautiful picture? Wouldn't you want to be able to have this in your neighborhood? In 2004, this was a rendering that was presented to many of the communities in Atlanta about this wonderful opportunity called the Beltline. And it was touted there as the, oh, did I do that? Oh, as the largest economic development opportunity in Southeast United States that would connect 22 miles of abandoned rail line, mostly abandoned rail line, to 45 communities in Atlanta that would allow economic development, that would bring transportation, all of this kind of development. And everybody was like, this is great. And what they wanted us to do was to pass this tax allocation district. Really quickly, TADs or TIFs, you might be familiar with them. If not, it's an opportunity for you to freeze the taxes at a certain level, and the increase is used to build out the infrastructure over the next 20 to 25 years. And so this is what was sold. I was a community leader leading a community development corporation and was like, yes, this is awesome. This is where I want to live. But this is what I was dealing with on a daily basis. I pushed this. Oh, this was the community in which I was dealing with. And this is what the residents in my community were dealing with on a daily basis. This was the stock, the housing stock in the communities, mostly in the communities in which I was working in. So think about if you were given that first rendering, right, as an opportunity to say, oh my God, this is what community can be, but this is what you were living every day. That's a stark difference. And so as we were thinking about what does this really look like, and those of you that have been to Atlanta may have been on the Beltline, it's still a wonderful trails and park space. Hasn't fully delivered because, again, part of the question was how do we move people to job centers, and there's no public delivery channel, so there's no either trail or that whole part has not been delivered, so people still can't move. And if you ever been to Atlanta at 1 o'clock in the afternoon, 9 o'clock in the morning, 4:25 in the afternoon, Sunday morning, you know that there's gridlock traffic no matter what time you get on I-75, I-85, and especially if you're in the downtown connector where I-20 all connects. 3 major expressways connect in Atlanta. So as I was dealing with that, my wife was like, well, we need to make sure that we are benefiting from this huge economic development opportunity that's taking place, because this is the housing stock in which we were living with on a daily basis. And so I was in a community meeting and we were dealing with kind of housing, public safety. We were thinking about all those kind of now what are considered social determinants of health indicators, where A researcher was there from Morehouse School of Medicine who came and said, he was just in our meeting. He was listening to what the concerns of the community were. And he took this map and laid it over all of our other maps that we were working on. And what he simply said was, it's one thing for you to be improving and working really hard to improve your neighborhood, but if this is the morbidity map, and the area, if you look at NPUV, I was working in NPUV, but that's close. Morehouse School of Medicine is located in NPUT. And all of this stuff is kind of South Atlanta. You can see how the highest incidences when it came to morbidity as it relates to other areas that were more affluent in the city of Atlanta. So he said, so if you're working to improve the neighborhood, who are you doing it for if the people won't live to be able to see the improvements? And that's where the light bulb clicked for me, saying, oh, maybe we need to be thinking about also how do we improve place and people at the same time. And that became my introduction to the work at Morehouse School of Medicine, specifically the Prevention Research Center, and my introduction to this world of public health. I'm just going to say next slide, because this isn't working. No, but I don't think I hear you. No.
I'm on now. Okay, good. So LaShawn was sharing his why, which is what he was already doing and how Morehouse School of Medicine being in the room to show the connection between what he was leading and what it had to do with health. It helped to spur his understanding of how we could collaborate and partner together. So again, it was about what we respectively valued and how we could do work together. And so just to again frame this discussion, and I talked about these principles earlier, what we want to lead you in is kind of that dimension that frequently is not addressed, and that is that you can do great community engaged work together, but really closing the loop is the impact that it makes, but also how you tell the story together. And so earlier I talked about how we looked at national principles and then normed them to our local context. But here the most important one is the value of dissemination, disseminating findings and knowledge gained to all partners. And even back before we were involved in 1998, community leaders said, we need to be telling the story together. So nothing changed in how they valued that national principle and how they wanted it to show up locally. So to the question that came up earlier by one of your leaders, how do you share the information back? They wanted to ensure that we were doing that together in all of the ways that it mattered. So not just through local radio, et cetera, which is the easy stuff, but also the things that provided opportunity and amplification for communities through those scholarly publications. And most of us in school, through our professional programs, did not learn how equity should show up in that process. So that's what we'll be talking about today. Next slide, please. So the grounds for a lot of our data and all of the ways that we write together come through this community health needs and assets assessment. And you may not necessarily be doing that through your local projects or research, but you might think about what is the data that we are gathering together through our research that could be the grounds for a peer-reviewed publication. But also, what is the process that you might also want to write about? And so we're going to be emphasizing and asking you to think about at least three modes related to your research or your partnership that you should be writing about. And the outcomes of that research is just one. So think about the people, the processes or partnerships, and the outcomes. So frequently in academia, we are thinking solely about when I have the results, when I have all of the data mined, et cetera. but think about the people as well as the partnership. So in this example, I will share with you about how we've not only used the community health needs and assets assessment, but we've actually also written about it. And you may have a process that you want to write about as well. Go ahead.
Before you move forward, I think there was a question earlier about the Community Coalition Board, and I just want to share with you that this is one of our opportunities to be really engaged. So where we meet 6 times a year as a board, it's the work that happens in the off months, right? And so this is part of our data monitoring and evaluation work, which is a standing committee of our Community Coalition Board, and it's co-led by a community member and a member of the team there at the Prevention Research Center. So this data, the whole assessment was co-created with community and academia together, right? So it wasn't created by academia and then given to community. This was co-created and co-led.
Mm-hmm. And that group frequently is the first place that hears about and approves the types of articles that we publish, because we're getting some type of data that we're using to tell our story together. So go ahead.
And it's our data. So we want to make sure not only we look at it, right, community, but it's our data to be able to use, not just the academics data to be able to provide and research.
Mm-hmm. So go ahead. Mm-hmm. Great. So I appreciate what you've shared. And through the Data Monitoring and Evaluation Committee, or the DME, some other things to keep in mind is that every data collection tool, and particularly the Community Health Needs and Assets Assessment, but when we do focus group as well as other qualitative data collection, they are involved in developing and adapting or updating the questions too. So just so you know, that Data Monitoring and Evaluation Committee is not just about the analysis, but even the survey questions, which have to be updated iteratively as times change. And so that's what's happening in the background. But analysis for us is particularly important because frequently that is just kind of the assumed role of the evaluation unit or the research center. But what we've learned is that, you know, mining the data in SAS or SPSS is one thing, but they provide understanding of the context to help to explain what the numbers mean in locally, right? So we see that African American women are saying, and this was a long time ago when I first started at the PRC, that they are, in some instances, still having unprotected sex with their partner, although they may know and feel that they should be doing differently. So our numbers indicated that they were having unprotected sex with partners. And this was in an area where there were high incidence and prevalence of STD and HIV, not just locally, but also in the Southeast. It's one thing to know that those numbers were higher than we needed them to be, but through conversations with our board and focus groups in the community, that analysis helped us to understand some of the reasons why, through women that looked like and lived in those communities. And it helped to inform the decisions about the issues that we brought up in our intervention. So just saying you needed to use a condom and talking about HIV 101, that was cute, but people already know that. There were other issues of power and control that had to be among the topics addressed. So analysis of data really helped us to know what's behind the numbers from a local context.
I was just going to say they allow the community to bring their lived experience into the analysis.
Yeah. So they help, and it helps to inform decision-making on even how an intervention may need to address other local issues, you know, beyond what might be the reality nationally.
And our principle is in yellow, so we are at least highlighting how we've been able to employ the principles that we've just stated from community-based participatory research and then the values that the Community Coalition Board said that were important.
So even this process of us including the value that was aligned with the activity, because we chose, in our instance, the CBPR principles, and we were able to show how this national model or international model was being operationalized locally, that has allowed us to tell that story of our process and how it's aligned with something national, but how we actually operationalize those locally, and we were able to tell that story as well. Next slide. So I showed this, but time was shorter earlier. We also wanted to demonstrate the ways that equity is advanced, not just how data is used to give us a priority for our research opportunity. So the Community Health Needs and Assets Assessment, or China, has certainly allowed us to identify and get funding to address diabetes, in case you can't read it as well, COVID-19, lots of funding in that space to address issues in Georgia. Because mental and behavioral health came up, we were able to make the case to the CDC that we needed to offer mental health first aid training, et cetera. So the CHNA was grounds for the types of grants that we have gone after because they're community responsive. But also, we want to demonstrate that through those, we're also advancing equity in our partnerships. So through those grants, we are also able to demonstrate integration of knowledge and action for the mutual benefit of all partners, because for our most recent PRC project, we have community-based organizations that are not just the implementation sites, but because we're doing implementation science, the funds go to those organizations with the plan that they will also be equipped to be able to be designated diabetes prevention program sites to enable them to get their own funding before the grant is over. So that is also then how equity is showing up, not just responsiveness to the health priority. Go ahead.
Research agenda just allows us to prevent mission drift. Our board is disease agnostic, but this also allows us to say, here is what the community has informed us of their priorities. We don't have to go back and ask. So when opportunities come, we can always say, does it align with what the community has said is their priority, right? And then, does it meet the criteria that we have laid out for the work that we do collectively at the Prevention Research Center?
I think someone asked that question. How do you forecast and ensure that you're not all the way off, you're not going all the way left? So this is one of the ways that we're able to do that. LaShawn is the principal investigator of one of the grants that came out of that priority of diabetes. So these are how equity have shown up. And again, we'll talk a little bit about the writing of that. So keep in mind, because you all are going to be asked to reflect and share based on the work that you're doing. Are you interested in people, process, or outcomes focus? Yes. Yeah. So I will share that because we do it at such a large scale. So for instance, with each funded research project that may be on a different topic, there are built-in assessments that happen. But the one that we're talking about happens every 2 to 3 years, just because it's so large. And just because we're looking at engaging community partners and residents in kind of a broader sweep of organizations, and now we've gone beyond local to statewide, 19 counties in the state. So 2 to 3 years is typically how frequently we do it, because we also have to make sure we're pulling together the resources to be able to support people to be champions of it, and this means fiscal resources, also funding to be able to provide incentives for community residents to do it, et cetera. So 2 to 3 years is on average how frequently we use it, because it takes a lot of effort, and we don't want to necessarily have it compete with something else that might be similar. Yes. Yeah, so our sample size was really thoughtful. The last one we did represented 19 counties in the state that were identified and prioritized based on the Social Vulnerability Index by CDC. And because COVID was happening, we also looked at the proportion of those that were tested or the prevalence of COVID-19 in those communities. Our sample size was 700, a little over 700 participants. Keep in mind, our intention is not to generalize, but to better understand based on need and also opportunity for partnership, what the people in those communities were seeing as things they were experiencing or those that they saw in the community. So we're not looking at generalization or necessarily broader representation, but the data that we gather at the community, at the county level is also a great way for students, but also community leaders to be able to locally use that data to make some decisions. So hopefully that's helpful. And in some of the papers that we're happy to share, there's more detail about how we've iteratively advanced our methodology in that space. Yes. Okay. Do you want to speak about that a little bit?
So depending upon, we've done community briefs. We've taken, for instance, if there's a specific area, then we've said, here's the data that we have for your specific area. Here's how you can be able to use it. And then we compare that data back to the general data. We've had community sessions where we're saying, here's what we've learned. Did we get it right? And so there are multiple ways in which we've been able to kind of share this. And in this analysis, right, what made this even more interesting is that we're in a urban footprint there at Morehouse School of Medicine, but we decided to move more into a rural. So we wanted to understand, making sure that we understood not just being in an urban environment, but what does urban versus rural compared to the entire state. Those of you that know Georgia, people say there's Atlanta and then there's Georgia. And we are trying to not say that there's Atlanta then Georgia, but there's Georgia, right? That includes Atlanta.
So we have a newsletter also that goes out pretty broadly. But as Ashawn was sharing, the neighborhood planning unit leaders that was represented on that map, what we've learned is that they want to continue to feel like they are VIPs. And so beyond broader community forums, we have thoughtfully brought those neighborhood planning unit chairs or co-chairs to hear about the information first, but also, more importantly, to hear from them what we should be doing, what action we should be taking. So this goes back to the fact that information out is one thing, but understanding the context and what we should do is even more important to them. Is you and then you, please, please, please. Mm-hmm. That's a very good question. So if we can go back one slide, we actually have Georgia Department of Public Health on our board, which is nice.
And the
An
local health
agency.
department. there
And
in-
Fulton County,
right.
yeah. And so they're involved in ideating and reviewing the survey with us. The big difference is that typically the community health assessments or needs assessments that are done by state and local health departments, they're really secondary data that talk about disproportionate hospitalization, illness, and death. But they don't actually typically query community residents to find out what are the health issues that they see as priorities that Morehouse School of Medicine as an academic institution should address, as distinct from what are you seeing in your community that you would like to see changed. And depending on the health issue, those responses might be different. Frequently, HIV is not me, but something I see. We also ask questions connected to the ways that they would like to receive health information or how they'd like to be engaged in research. The state and local health department survey does not include that. That's specifically for us to be able to know how we need to evolve the ways that we are better communicating and engaging. So those are some things that I think are different and really complement the secondary data that might come from a state or local health department. So they complement each other, but we are really looking to hear from them how we should be behaving and moving differently over time. Hopefully that helps. Yeah, okay, yeah. Was a question or comment back there?
So the answer is yes, but we have to be better at doing it.
Absolutely.
And so what we didn't get into, but I'll share with you, is that one of the other assessments that we use is we assess the Community Coalition Board annually. They have a satisfaction survey that is conducted. And one of the issues in which I use as my report card as chair of the Community Coalition Board is that we've not gotten to like an 80% of saying, how are we sharing this information with elected officials? So we're continuously trying to think about what are those measures? How do we get those elected officials and those policymakers in either a room, or how do we share this for them so that it informs their decision-making process? But yeah, it's a tool that we are working harder to get better at.
That to me is not the final frontier, but an important one. And I think we have more of their ear now due to the local closure of one of the largest medical centers, closed a couple of years ago. And so we have been a part of an effort to understand how community residents are responding to where they would normally go to get care. And so our collaboration with the local health department and certainly policy officials has them leaning in a little bit more to us to hopefully be the voice that they listen to. But ultimately, I think CTSAs and PRCs should be where they can look to get credible information, local policy leaders as well.
That was a nice way to put that. They
It
closed
should.
one of our Trauma One hospitals.
Go ahead, yeah.
Shut it down in one of our Black
In the
neighborhoods.
South, yeah. Yeah.
I mean, that's it. And so it was like people were without care. And so it put more pressure on the public hospital to do even more than was happening before, because it wasn't economically feasible for that provider. Okay, so I can say that.
You can. And that happens only in Atlanta, right? Only in Atlanta. All right, let's move forward because we want to get us into you thinking about some of your writing as well.
So I am not going to go over this slide, but I do want to share with you that I joined the Community Coalition Board in 2006 was my first encounter, and I became chair in 2010. And I came to this work with no background in public health, right? But really thinking about how do I improve the health of the people in which I'm working, living, and playing with on a daily basis. And since then, the capacity that has been built for me, or closing the gap, has allowed me now to even think about, now how do I become an investigator on some of this work that's happening? And so I'm a co-principal investigator with on our newest REACH grant, which is focused here on providing implementation of evidence-based culturally tailored policies for Black and African American and Hispanic and Latino populations in Fulton County. The next slide. And this is what our REACH work currently is. Our goal is to improve the prevention of chronic disease and reduce health disparities among those populations. It's really thinking about kind of what is a community-based physical activity program, kind of how do we have equity, justice, dignity, and we're still using those words. I know we're still using them. Yeah. policy systems and environmental changes, and then kind of what's this transdisciplinary community-centered coalition approach. And this is all still guided by the Community Coalition Board because this is a part of the Prevention Research Center. So even though I'm chair, I report back to the Community Coalition Board. It engages other members of the Community Coalition Board to be a part of this work, and and we use them as our governing board to make sure that our work that we're doing in the REACH project is still meeting the values and the missions that the board set out.
LaShawn, there's another question.
Yes.
Go ahead.
So I'm going to answer it this way. I think it's our work to build the bench strength of community residents to understand what does evidence-based research look like, help them to better understand it, and use them as to be the advocates to the elected officials. It's one thing for us representing Morehouse School of Medicine to be able to say it, and they were like, oh, you're just concerned about your research. It's another thing for a community resident who is a voter says, this is how this has impacted me. Here is what I understand this research has done, will do for my community, and this is why I need you as the elected official policymaker to pay more attention. So our goal is getting more resident engagement to ensure that it helps kind of to groundswell that information to those elected officials that might be a bit cynical and not interested in evidence-based research.
That's right.
Mm-hmm. Mm-hmm. That's our work.
So I want to just be sure that LaShawn, what you said is so key, and something that we have built in actually to another NIH grant through a community-based organization, is policy and advocacy training. I know I didn't learn it in school. The first time I went to the Hill was with LaShawn, who was a local policy leader, and we were able to talk about research that his organization led, that I was a consultant in, but we had evidence on the research that was done led by his organization. And so that was one example in case we don't get to it, but we need to get to it. But equipping both us in the academy and community leaders with the skills to effectively advocate for policy that addresses local community needs with that evidence is something we realized that we needed to put funding towards. Because in many cases, neither of us do it well and end up being very passionate, but people don't listen. Because we don't understand how to do it effectively. So actually at our CTSA meeting in Georgia coming up in April, that community-based organization is going to be leading a 2-day training on policy and advocacy. That should be connected to more trust in science and the ways that people can turn the ear and the head of a decision maker.
Mm-hmm.
So thank you, LaShawn.
The next slide, please.
We're moving along. We'll take one more comment before we get into the details. And I know, Dr. Leary, I know we have a little more time. When do we officially end, just so we can level set? Is it 12:20-ish? Yay. Yeah, please. Yeah. Yeah. So it remains to be seen. We're still just in the beginning of March. But there's a lot that I will say. a lot of tissue that has been thrown against the wall to see what will stick since the beginning of our administration. And what we have been working to do over a few short weeks is to be much clearer with our local government affairs leaders in our institutions and beyond to clarify what our work is, what it is not, and the reasons why its relevance is still important. Improving the health of those disproportionately experiencing greater hospitalization, illness, and death is what we are doing. And I didn't use the word diversity, equity, or inclusion in that, though, as we've shown, we're still using those terms. The facts are these groups, and you can plug in whoever they represent for you. It might be a racial or ethnic minority, a rural population group. In some instances, through our CTSA, we actually have a current pilot awardee that is addressing healthcare perceptions and experiences of LGBTQIA youth in mental health spaces. We cannot deny what the statistics are saying about disproportionate suicide, disproportionate hospitalization, and poor experiences with the healthcare system. Our CTSA, in part, is designed to do that, to create, and support clinicians who are better equipped to serve all. So a long answer to your question, I think our collective work is to clarify exactly what we are doing. And equity is more than what they might be misunderstanding. It is about addressing those who are disproportionately dying and experience greater morbidity and mortality. So what we found is that at least to date, nothing has been paused or stopped. And so a part of our understanding through a number of faculty in our department who actually have law backgrounds is helping us to understand what is true, what is not, what today is legal, and what is a distraction. I think one of your leaders earlier said that we have to be careful about letting all of what we're hearing distract us so much that we stop doing the work. So hopefully that encourages you for now. I certainly have to say it to myself daily, minute by minute, but it still remains to be seen. Thank you.
So this slide was put up because we were going to talk about writing, but I think it just speaks exactly to what Dr. Akintobi just shared, right? It's about context. Mm-hmm. Even in that situation about how do we continue to do the work, what's our partnership process? And so being in partner with your community partners that might be able to say things a bit more boldly than the academic institution can, right? And so it's, I remember when we went to the Hill really quickly, I met with the community affairs person and he kept telling Tabia, you cannot say this. And I says, but I can. And he kept saying, but Tabia, you cannot say this. And I says, well, tell me all the things she can't say so I know what to say, right? Because we're in partnership together. And so we did that. I mean, right now in the legislature in Georgia, they just passed a bill that will get to the floor. The bill hasn't passed it forward the bill that says any school K through 12 and higher institutions that do DEI might lose their funding. We now have community residents down there at the Capitol saying, I need you to understand what this impact looks like. Georgia, and I know I'm a little bit off the subject, but we'll get past, just lost almost, I think, a $4 billion industry because of some of the latest legislation that has been passed nationally that cut out the electric batteries work, right? And so the entire plant closed. They hadn't even got started, but that was jobs, $4 billion economic hit to the state of Georgia. And so now they're saying, well, wait a minute, how do we get those jobs back? And it's like, well, wait a minute, you should have thought about that in the beginning, right? So, next slide, please.
So how can we be aware of context and not miss the opportunity and the recurring moments that we need to make in telling our story? So we're going to take this slide together and then we're going to move into hopefully a few ways to hear from you. So when we think about this scholarship together, which historically We've not been trained to do it. Community partners have not necessarily been systematically invited to tell the story that they helped to write. But for us in the academy, we know that there's some scholarly output that is important to our advancement. Yes, we can say we got to publish, right? Professional recognition is important when we think about peer-reviewed publications. For us now, we are valuing in tenure and promotion team science. And so that team for us means teams that include both researchers that don't look like myself as a social behavioral scientist. It includes team science that includes the next generation of learners and leaders who don't yet have a degree. And it includes folks like LaShawn, who is central to teaching me how to do better as an academic. Credibility and trust, professional development, inspiration for future research, and our contribution to the field. And some of these really have blurred lines, but for us, this is a part of setting the stage in terms of thinking about the value, and you may have other things that you would add to that list.
And then quickly for the community, right, it helps us with the decision-making. It allows us to kind of foster these collaborations. It fosters this kind of community ownership of the problem and the solutions, right? So many times we're trying to say, how do we get this then implemented in community? Doing this up front allows this shared ownership. It enables the community to participate not only in the planning process, but in the design of the intervention so that it is even more successful, or at least the opportunity for it to be successful is there because it's already embedded in community. The next slide. And then as we build the credibility, both Tabby and I have been learning that, this is a process that helps us both, right? And so we, in partnership with Progress and Community Health Partnership and other partners, right, we said that there's these 3 L's that are really important, right? This learning domain, this legitimacy domain, and this legacy domain. And that there's benefits to all of us in there. But I will tell you, as a community leader, I didn't understand the importance of what this publishing can do, right? But it brings credibility, and it allows me to be able to not only be able to cite my lived experience, but my research experience, right, as well. And that, I'm cited now as certain documents, right? So, this published work can be really real, and it really helps community leaders to understand, why is it important that I need to be doing this work, especially when it comes to kind of dissemination and publication with the researcher. But there's different ways that you can do that, right? And so we want to talk about what are some of those different ways that helps to bring credibility to the partnership, both the community and the academic partner.
Next slide, please. I already talked about this. We can keep going. Well, I think the only thing that I would pause, because most of you were in the previous session, we have community co-authors on this. This is an example of the outcomes of a community engaged research project. So I've talked about you thinking about and sharing shortly a potential focus based on a project on the people, the partners, or the outcomes. And so this is an example of the outcomes where we found that the peer-to-peer arm of the study was more likely to get more Black older adults screened for colorectal cancer and ultimately referred for services. So this is a implementation science example, but even within it, we still talk about the process of community engagement, CBPR, et cetera. So get ready. We're gonna ask you to think about your own project. And I think within each project, there are at least 3 papers that you can be thinking of, and they don't have to necessarily be in a particular order, but this is one that speaks to the outcomes through an implementation science approach. Next slide, please, and we're gonna move quickly. This project was the REACH project that we had immediately before the one that LaShawn is the MPI for, and it involved promoting healthy corner stores and safe places for people to be physically active through partnership with local corner stores, and there are 2 community health workers who are part of that project. Next slide, please. We published 2 papers, and just quickly, one of them was about the approach, so the partnership and the model. So this had nothing to do with the outcomes, but we have a number of organizations that have reached out to us because we talked about the process of engaging these corner stores that really don't care about health. They are business owners, but really helping to make the business case for why something like this was something that they should invest in. This was a paper just on the local context and the people that were affected by colorectal cardiovascular disease that we focused on. Two different papers, neither of these were focused on the outcomes, but they were on the process of partnership, but also the context within which the project was implemented. So I've showed you one on the outcomes. These are on the context and the people. Each of these also have community co-authors. And the ways that we did this, in one instance, is that we had a set list of questions specifically connected to a session of the paper where we wanted their input and perspectives on what it looked like, how they felt their engagement was valued or not, because that's a part of the learning as well. And then what were the implications of what we did together on what we should do next? That was a key informant interview guide. And because we knew people were super busy, we actually did those interviews with each partner, and then we used that data to inform the sections and ultimately shared it back with them for final review, et cetera. So that was one way. So those busy folks did not have to write anything, but their wisdom and partnership were a part of what landed in the paper, and that's how they were co-authors. So think of potentially key informant interviews. And then in some instances, we've used focus groups where we might have been having a board meeting or getting a network group together. And we use that as the place where we were gathering the information. So think about the mode of engagement and how you might think beyond just saying, here, write this section. These people are busier than we are, so we got to do better, but acknowledge that they are the co-creators of this. So thinking thoughtfully about ways to engage them are important. Next slide, please.
So this was, and the next slide, please. This was a health project that was led by community, which is flipping the script, right? So all research doesn't have to start with the academy, right? Research can actually start with community. And this particular funder said, we want this research to be grounded in community and that no academic partner can go after this, but you need to be in partnership with an academic institution in order to be able to secure this funding. And so this was funding in which we wanted to look at minority men, oral health, and dental access. We were the one of 4 recipients, I believe, that received this, and the only one that looked at this work. This was different. Next slide, please, because Morehouse School of Medicine was the sub-recipient. And even in our partnership and our long-standing partnerships, we also understand there's some institutional barriers that we still have to overcome in some of our institutions. And so one of them was they kept sending me a contract saying, give us the money and we'll administer it for you. And I kept sending them back saying, no, this is my contract. You're the subrecipient. This is how we're going to be able to do that. Very different for the legal department there. They kept saying, Tabia, we don't have the money. And she was like, yeah, it's not our grant. But it was redefining how these partnerships can be defined, right? It doesn't have to always start with one partner. So another opportunity might be, what are those other philanthropic partners that want to invest in some of those words that we might not be able to say DEI for a while, that community can lead, right? And then have you as a partner to come along aside. So I'm just throwing that out there. Next slide. And so from this work, it was a pilot process what we were doing, but what made this even more important was that, Tabby was like, we need to publish what we learned, even in this pilot process. And it happened to be published on the day that she and I were on the US Hill advocating for the prevention research centers as they were being thought about, zeroed out in the federal budget. And the paper was released in the American Journal of Public Health.
The American Public Health Association's journal.
And I was the lead author, which was really interesting because in this picture here, I'm the only community member that went to the Hill to help advocate. The rest of them are principal investigators from other prevention research centers. And what was really interesting, and when I think about this whole advocacy and the partnership, right, was that once we started talking to our elected officials, they asked me, LaShawn, can you go in and talk to this representative from our state? Because what ended up happening was the representatives wanted to hear from the community and how that impact and how this work was impacting them, not necessarily from the researchers. And so I led then something I was invited to just be a partner on, end up leading discussions with policymakers around why this work was important for the Prevention Research Center. Next slide, please. And she shared this with you before. This is some other work where I'm a co-MPI related to some diabetes work. Next slide, please. But we do want to talk about this process, partnerships, and outcomes.
Yes. And I just want to say, I knew that I couldn't go to the DC Hill without LaShawn. My other colleagues didn't know that they needed theirs. And so when that, the attention in the room shifted, where we had the data, because we had this publication, but we had the community voice, the impact was like it would never have been. So when we think about policy, the respect for science, it requires us showing up together to be able to have him answer questions that I can't, and vice versa. So these are just more examples. Maintaining and scaling an established community engaged research coalition board. We did that through interviews to get that data and to take the publication drafted back. There's one that we did that's focused on a network in Georgia that LaShawn leads through the Prevention Research Center, focused on addressing the community engaged leadership and processes of other minority serving institutions and HBCUs in the state. Lots of students, but also community leaders, and then another that's there. So let's take in the next few minutes that we have the opportunity to hear from you. And as we've quickly gone through these ideas, to have you think about your own potential publications and next steps. Next slide, please.
So get your phones out. We want you to scan this, and we have this question that we want to be able to ask you. So based on your reality, we want you to rank the following factors that may be a challenge in academic community writing partnerships. And so once you scan it, it should be up and running. You click, the first one is your first choice. You can click the second one and third one. You can unclick them if you think you picked them in the wrong area, and you'll be able to see this on your phones in real time as everyone starts to weigh in. So as we're looking at this right now, time, oh yeah, now the votes are coming in. Take a few more minutes. 16 people are voted. Up to 21, few more votes. So out of the three factors, it's know-how, time, and infrastructure in that order. The next slide, please. So we wanted to hear from you around kind of what does this ranking look like as it relates to what might be some of the challenges that you occurred. And when we did this work with that network that I lead in on behalf of the Prevention Research Center of other minority serving institutions, this was some of the things that they came back with, right? That community-based projects take too much time to complete, that some said, yes, it's difficult to find the appropriate partners, that there's this diversion of time and resources, scarcity of funding, too many competing demands to make partnerships. And I said, yeah, that might be it, but how can we make these, if these were facts, how do we make them myths? And so what is it that we should be doing and working collectively together to say that, yeah, it may take a little bit more time, but not too much time. But the time that it's taking for us to complete the project enhances, makes the project richer. We go deeper. We have a long-lasting relationship. Those are ways where we can turn that what might have been a fact for them into a myth. And so these are just some of those challenges and opportunities you might be facing that I'm challenging you, saying that if you're saying, yes, this is one of my issues, how do you then start to think about how to make this a myth using kind of using the community engagement process or CBPR principles? The next slide.
So the time issue. These are some things that you should be thinking about early and often. And because we want you to focus on the people, the partnership, and then the outcomes, build this into those things that you talk about with your community or patient partners or advisory group to talk about from the very beginning. Our partnership with that journal and with the NIH to do a 5-part workshop to unpack a number of these topics, this is a crash course, is where we had community leaders in the room that said, we didn't talk about this early. Or I might have had a PI that said, oh, we're gonna write together. But they didn't know what that meant. They didn't know what the order of authors meant. They didn't understand what the implications might be for that publication in a positive way for them. So in some instances, because they hadn't unpacked these issues, they felt a degree of coercion because there wasn't enough time spent actually socializing publication as a part of community engaged research from the very beginning. So deciding on the topics and broadly those 3 categories can be helpful. And all of you should have this handout that speaks to some of those preparation, we call it a preparation primer, the things that you should be thinking about, negotiating, and socializing with your partners now. Negotiating authorship responsibilities and priorities. And I talked to you a bit about the ways to potentially get that information or find out what works best for them. Creatively engaging in contribution, review, and approval. Do this individually. So some people might need to think about it. Some of it might be their first time. Others have done it before. And they allowing time for recovery and response. Many of us know that the first time you do this, I mean, I probably have maybe 3 publications among many, many, many that ever got published the first time. So having this as a part of the muscles that you are building together are important. So thinking about these things early and often, make it a part of what your community engaged research partnership is about. And we didn't start doing this till probably about 15 years ago, socializing this as a part of what we do together. And I know time is generally
We have about 3 minutes.
Okay, all right, next slide. So here is what we want you to think about, and we'll make sure that we get this to the team so you can have this as a resource. This is before you start to think through these issues. So we're gonna give you just a minute or 2, literally, to think about a project that you've either completed or are working through, and to simply consider and be ready to say a word about whether you would be focusing on or potentially will focus on the process, the partnership, or the outcome. And so since time is so short, we'll give you a minute to think about that, and we invite a few of you to talk about which type you will focus on, and then to describe it briefly. And again, this tool is really designed for you to think through and to begin to document what you're thinking, but of course, you are not in isolation on your team. This really is an iterative process. And for those of you who are interested, that workshop that we're doing with national partners and through conferences is something that can help you to unpack it further. All right, so we'll give you a minute or so, and some of you might already be ready to share process, partnership, or outcome, and why. Go ahead. Mhm. Okay. Where did you publish it? So it's in. Good, good. Any community co-authors? I don't want to assume. Okay, great. Mm-hmm. Yeah. Mm-hmm. Great. I keep on saying, I wish I had had this exposure much earlier. So it's great that you were engaging high school students. Yes. Yeah. Yeah. Mhm. 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 Yeah. Mhm. Mhm. Exactly. That's been the time saver, is having discussion groups. One time we even used a mentee survey to have concepts related to particular sections. Go ahead, LaShawn.
I know that we're out of time. I didn't know if there was one more slide you might want to be able to share. Maybe the next slide.
Let's see. Go to the next one. This one I think is important, and I'm assuming the slides will be shared. Yeah.
Okay.
So we're available, but this one really unpacks the process that frequently takes longer. And also, what I think the biggest part of this is demystifying the whole notion of being a co-author. Because oftentimes that's where the reticence comes. People know they've put a lot into it, but they don't want to necessarily have to do, the heavy lifting. And so the ways that we can really be thoughtful about having an interview or a focus group, depending on what you know about your partners and the way they like to communicate and share information, is one way. And then subsequently, you will want to have validators. Once the paper is drafted, everyone has an opportunity to review it. And what we found is that even those who say they don't want to write and review, given after everything is pulled together, please know that they want to edit and also scratch and add their feedback as well. So again, this has been a crash course. Obviously, there's interest in some of you who have done it well, but we're here for the rest of the day and we can talk about ways that we can dig in, because it really is iterative. And once you socialize it, I mean, we have a writing dissemination group that during one 6-month period, we publish 15 papers. That's typically very hard, especially in the work that we are doing. So when people understand that everyone benefits, it's not a one-person sport, it becomes more efficient, and we begin to change that myth, that what is considered a challenge to a myth.
So here's what I'll end on. Someone asked in the earlier session, how do you share this information with the community, right? You can take this same scholarly journal paper you just wrote and think about then, how do the high school students then start to translate that? It could be through videos, it can be through TikTok, it can be through a 60-second video clip. I mean, there's many ways to disseminate this information in a meaningful way to many members of the community. We have to make sure that we're tapping into all of our partners saying, how do we now get this important information out, right? So it's not just in scholarly journals. It's a community brief, right? Here's 5 points that you should know about this stuff. There are some creative ways to be able to do it. You just have to make sure you're engaging your partners in meaningful ways that can help you to think through that. I'll tell you this really quickly. We were thinking about a project that we were going to do, and we wrote this grant, and we said, yeah, we're going to use Facebook, and we're going to talk to youth, and da 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 da. And by the time the grant was funded, the young people said, we don't use Facebook. Our parents on the old people on Facebook, and I was like, oh, I guess I'm old because I'm on Facebook. So we had to adapt, right? And we had to go back to the youth and say, we should have asked you in the first place. What platforms, media platforms, do you use in order to be able to get this important information? Once we got it out there, they started sharing information among themselves. We were able to kind of educate them around STIs, STDs, and HIV prevention and intervention. So I just want to share that with you. I know that we're over time. Thank you so much for engaging our TED Talk. And we're here to answer any questions you might have.